Thank you for coming out to today's candidate forum on public health. I'm sorry to miss the chance to be with you in person. It's been the honor of my life to represent you and your families in Congress, and I'm proud of my record of delivering results for you there, working in a bipartisan fashion. In fact, 68% of all the bills signed by President Trump have been bipartisan. That's the highest level in 20 years. And this past year has been especially productive for me, as I've had 10 bipartisan bills pass the House and 5 signed into law. One of those bills was my legislation to bring more doctors to Eastern Washington by extending and doubling funding for the Teaching Health Center graduate medical education and residency programs here in Eastern Washington, especially in rural and underserved communities. As we know, where someone does their residency means they're more likely to stay in that area to practice. That's why I want those residencies right here in Eastern Washington, so our doctors stay here to care for our community. As many of you know, I have deep roots here in Eastern Washington, growing up in the small town of Kettle Falls. I understand and have lived through the challenges that those in rural communities face when it comes to accessing healthcare. And that understanding has grown since being in Congress as co-chair of the Rural Health Coalition. I've visited hospitals and healthcare facilities all throughout Eastern Washington, especially in rural areas, and believe no matter where you live, you should have access to quality and affordable healthcare. It's heartbreaking when I hear from providers and hospitals in these rural areas who are having trouble keeping their doors open because of the low reimbursement rates and high populations of Medicare and Medicaid patients. My goal is for Eastern Washington to be a center for research and innovation. That's why I led on the 21st Century Cures Act, signed by President Obama, which is creating an environment where new life-saving drugs can more easily get into the market to save lives. This year, I'm also proud to say that I've continued our commitment in Congress to funding healthcare research. In addition to billions of dollars in increases for funding for the National Institutes of Health, we have tripled funding for Alzheimer's research and significantly increased funding for cancer research. I believe this election presents a clear choice between my record of standing up for Eastern Washington values and my liberal opponent's record of raising taxes and forcing Seattle priorities upon communities, workers, and families in Eastern Washington. My vision is for an America of opportunity. Every person has value and purpose. I believe in empowering everyone to make their own decisions and giving them the freedom to choose their own path. Again, I regret that I can't be here with you today. I hope you'll visit my campaign website at cathyforcongress.com to learn more about my full record of delivering results as your independent voice in Eastern Washington. Thank you.